Inflammation in this case isn't the enemy. It's the body's way of protecting itself and starting repair. But if the inflammation runs unchecked, it can slow healing and even set the stage for chronic problems. So our goal is not to shut down the process, but to optimize it. Welcome everyone. Today we're going to be talking about something every practitioner will face at some point in time, and this is how to handle acute injuries quickly and effectively. When someone sprains an ankle or they pull a muscle or they suffer an impact, the first 48 to 72 hours are critical. What we do in that window can dramatically reduce pain, speed recovery, and prevent long-term complications. So in this training, which I've titled Rapid Recovery Protocols for Acute Injuries, we are going to go step by step through an approach that we can start using right away. So what is the acute injury response? Because this is the first most important piece. When tissue gets damaged, whether it is from a sprain, a strain, just trauma, the body immediately activates an inflammatory response. We will see pain, we will see swelling, we will see redness, we will see heat. Sometimes we will see loss of function as well, depending on how bad that is, typically more like a break or something. Now, inflammation in this case isn't the enemy. It's the body's way of protecting itself and starting repair. But if the inflammation runs unchecked, it can slow healing and even set the stage for chronic problems. So our goal is not to shut down the process, but to optimize it. We want enough inflammation to begin repair, but not so much inflammation that it creates more damage or it delays recovery. Now, traditionally, you may have been taught RICE, right? Rest, ice, compression, elevation. But research and experience shows us that we need to refine this. Complete immobilization, for example, actually delays healing. Instead, gentle movements help maintain circulation and prevent stiffness. Microcurrent therapy is key here. It's one of the fastest ways to reduce pain and swelling, and we can do it with the right frequencies without killing the inflammatory reaction. So what you want to do here is you want to use your device on frequencies lower than 100 hertz. Truth be told, it probably doesn't matter as much what they are. It's more that they don't turn inflammation down, but they stimulate healing and ATP production. ATP production is the big part here. This is the energy currency that cells need in order to repair themselves. Patients often feel relief within minutes of doing this, and it can restore function and allow them to continue. Hydration is critical too. You may not think a sprained ankle means that you need to drink more water, but drinking water with electrolytes includes the ability to enhance cellular repair. Cells just can't repair if they're in a dehydrated state. So right away here, we see movement, microcurrent, and hydration become our frontline tools, not rest, ice, compression, elevation. Now, once you've handled the immediate response, you have to look to fuel the body's recovery systems. Bioenergetic therapies are key here. We want to restore cellular function through our microcurrent therapy. And at this point, we want to get rid of the inflammation pathway. So this is post 72 hours, right? 48's kind of way you could start doing this. But you also want to get the raw materials into the body that the body needs. Vitamin C is something that we should probably be taking all the time anyway, but this is important for collagen production and antioxidant support as well. Proteolytic enzymes, bromelain, for example, this can reduce excess inflammation. Omega-3 fatty acids balance the inflammatory response and enhance repair. And magnesium relaxes tissue and supports repair too. So think about the fact that we're not really just building a symptom killing plan here. We need to restore the nutrients to rebuild the tissues as well. After these 48 to 72 hours, inflammation should naturally begin to subside. And here we can also shift from protection and low frequencies into the higher frequencies too. This is where you want to reintroduce some controlled movement, some gentle mobility exercises that restore function and remind the tissue how to work. You can alternate hot and cold therapy. Hot will relax muscles, cold will reduce inflammation, and this can also improve circulation, which will remove the metabolic waste in the body. But ultimately, what you really want to do here to drive this home is get the therapy on there, get that inflammation down. You can combine microcurrent with light therapy, with the Acute, to get that inflammation going down and to repair the tissues as well. And there's a mind-body element. Big injuries can be very stressful. Try and keep that stress down too. So the protocol itself, let's go into the microcurrent pieces here. As I say, anything below 100 hertz. Depending on your device, this is going to vary as to what you're going to be doing. If you have the Pinnacle, use Sana Trauma. The first 48 to 72 hours, just use Sana Trauma, and you can't really overdo this. This is an acute injury protocol that is designed to reduce inflammation without getting rid of it completely. So it will dramatically reduce the pain and speed up the recovery. It also layers in regenerative frequencies to start the repair process too. Okay, this is also set to go pretty deep. So that's the Pinnacle. If you had the Evolution, I would probably turn to FM-RSI. This is a nice low frequency, but it also does really well at reducing pain, building up ATP, getting circulation into the area, and will accelerate the healing process. And if you're using the other devices, I would really have a hard time pinpointing the best option here, because blue stimulation in the Blue and the Genesis 2, this is a good choice because it does start low, but it also goes high. It goes from 21, 22 to about 163, and that's above 100 hertz. Now, does it do it enough to completely get rid of the inflammation? Possibly not, but I would err on the side of caution and stimulate the area with 77 hertz, which is your basic soft tissue repair frequency. Moving this over the area is going to be the way to go. The Y probe is great, but quite frankly, for acute injuries, I find that the pressure control of the massager electrode is unmatched, and being able to get into the areas and just kind of put the pressure you need, especially when muscles are tight and kind of clicky, is really, really powerful. It will enhance the process. So those are your kind of starting frequencies. At that point, after this is done and you've incorporated this with some guided movement and some solid hydration, then you're going to support healing with some targeted nutrition and starting on those anti-inflammatory frequencies. At that point, switch to 121 hertz. Go for 350 hertz. Go for SanaSurf 350. Throw the normal pain protocols at it. Get that inflammation gone, because at 72-hour mark, you no longer want it in your body. And when you follow these steps, you will help the body to heal faster. It will reduce the pain naturally. And most critically, it will prevent an acute injury from turning into a chronic problem. That is the biggest issue with acute injuries, in my opinion. People rest for too long. They don't do enough to accelerate the healing process, and then it quickly becomes a chronic problem. So we're talking here about rapid recovery, right? That is the key. Intervene quickly, support these processes, restore function, and you will recover rapidly. You will be the one that sees people turning around and saying, wow, how do you no longer have that sling on, right? How are you out of that cast? And I'm talking about broken bones here. Like, we've seen accelerated healing in bone breaks that you would never expect to see, as well as, of course, muscles and things like that. Now, one final point here is that once you've hit this point, recovery's happened, you're a couple of weeks in, I would return to that injury and treat it as scar tissue. Give it a scar tissue treatment for just 3 to 5 minutes. The body will rapidly repair tissue using scar tissue as its answer. Don't allow that to linger and fester and become a problem for the body electric down the line. Post-injury treatment of scars, 1 to 2 weeks after, is a great way of keeping your body electric running and preventing these things stacking up against you down the line. So thank you everyone for joining me in this training. I encourage you to start applying these protocols in your practice right away. You've all seen someone come in with an acute injury. And if you haven't seen it in your practice, you've probably seen it in your personal life. Your patients, your family, your loved ones, your friends, even you'll feel the difference. Thanks everyone. I'll see you next week for another 10-minute training. Bye-bye.